So looking at the posterior aspect of the lower leg, again, we're going to have a lot of branches here. You can see up at the picture, we have a lot of things going on. We're only going to cover up to about this point here, okay? The rest of it's going to be covered when we start getting down into the foot and the ankle. So we're not going to worry about anything distal to that black line just yet. So again, here's some rudimentary drawings, and we're going to work with it. Okay, so here's my femur. Not really going to mess with the patella at this point because we don't really need it for this drawing. Here's my tibia. And that's going to be my fibula. So what we're going to see is we're going to see the popliteal artery exit through the adductor hiatus, and it's going to give off several branches. These branches literally are named for where they are in the knee. So this is going to be my popliteal artery. This branch here, superior lateral geniculate. This branch here is going to be the inferior lateral geniculate. Again, says what it is what it says. These are all based and named on where they are located in reference to the knee. Here's my superior medial geniculate and my inferior medial geniculate. Remember also we're going to have this descending genicular as well, coming off of the femoral artery. So once we get distal to the knee, now we're going to start seeing a lot of branches. One branch we're going to see, and we just saw this in the last video, in the last picture I should say, is this anterior tibial artery. That's going to shoot forward, remember again, through that aperture, because here's my interosseous membrane being drawn in here. It's going to shoot forward, it's going to shoot anterior through that aperture, and it's going to supply the blood to the anterior compartment of the lower leg. Once that happens, now I have a posterior tibial artery and that posterior tibial artery is then going to shoot off a branch that's going to travel down the fibula. Well, if it travels down the fibula, guess what it's named? That's right. It's the fibular artery. Pretty darn easy. Now, like I said, as we move more distal down the leg, down to the foot and the ankle, we're going to get into a lot more branches here. But for right now, this is what we're going to go with. So here's the innervation to the posterior component. Again, when we get into the foot and the ankle, we're going to go much more in depth and much more in detail with this. What I need to know here is that my tibial nerve, circle here, It's going to give off a lot of branches which are going to supply the gastroc, supply the soleus. So that's my tibial nerve. It's also going to give off branches that's going to supply the deep posterior component as well. It will then continue down, as you can see with the picture here, and it'll travel through the tarsal tunnel. It'll travel through, to give you a point of reference, if this is my calcaneus, this is my heel bone. It'll travel medial to that in the tarsal tunnel, along with the, quote, Tom, Dick, and Harry